Back pain has to be one of the most frustrating injuries during sport. At least when you have an upper extremity injury, you can work on some lower extremity skills, or if you have a lower extremity injury, you can work on some upper extremity skills. But when you have back pain, it's almost impossible to make it through a practice. That's why this is such an important topic. I'm Dr. Goldstein. Let's talk about back pain in adolescent sport. The goals are to discuss the common causes of back pain in the adolescent athlete, when it could be okay to wait, and when you should be going to the doctor. The word spondylolysis, which is a type of stress fracture in the low back, and exercises that could reduce that type of pain. A red flag is a crash where there's midline back pain. There could be weakness or tingling into the extremities. Or there's a mental status change, like a concussion, and the athlete can't tell you how they're feeling. In those cases, the best thing to do is to keep the athlete still and call 911. Get as much help as you can to stabilize the neck and safely move the athlete. You know, there's never a case where you do too much, even if it wasn't needed in the long run. But there are cases where you regret you didn't do enough in a catastrophic back or neck injury. So if there's a question, it's better to call 911. A yellow case is worsening pain when you try to get back to sport after a crash that didn't have midline back pain and didn't have weakness or tingling into the extremities. In those cases, I think the best thing to do is to stop practice, call the parent, and get them to a medical provider to get a diagnosis of what's causing their pain. A green flag doesn't mean they're not having pain. It just means it's okay to continue training while you're working through things. There wasn't a crash, there's not midline back pain, there's no weakness or tingling into the extremities, but things aren't getting better after 2 weeks. I think that's the time where it's probably right to get a diagnosis and get some more information. I think for all of us, the goal is to have the athlete working at their highest potential, enjoying the sport, safely learning new skills, and not prevent them from progressing because of pain. Here's when you should consider seeing a doctor sooner than later. When it's midline, like the yellow line, it's more likely bony and probably deserves some diagnostic studies, whereas the green circular areas are more likely muscular. Below the belt line is perhaps bony, could still be muscular, but above the belt line is more likely muscular. Certainly adolescent and college age kids are more at risk for stress injuries than grade school age kids. And the red triangle is the area, especially if the pain is in extension or when you're bending backwards, to be more likely the area of where a spondy or a stress injury occurs. So there's no midline back pain or weakness or tingling in the extremities. I think it's okay to try a treatment first before going to the doctor, starting with anti-inflammatories like ice, Motrin, or Aleve, along with modified workouts that take out skills that cause pain. The appropriate time frame is probably 3 to 5 days to show some improvement, and then starting to progress back to full sport. If it doesn't, I think it's unrealistic to think that if it hasn't helped in 3 to 5 days, it's going to help in 3 to 5 weeks. Taking nonsteroidals for a long period of time can cause stomach ulcers and kidney trouble, so 3 to 5 days is probably the limit for this treatment plan. There is research on physical therapy, chiropractic, and manipulations, and growing research with dry needling and sports massage. There's mixed results with TINS units, topical compounding, and KT tape. It's okay to try it, but the research isn't strong. The reason dry needling works, by the way, is a thin filament is placed into the muscle to cause a local twitch response, which activates endogenous opioids and lowers pain. It's exciting stuff and worth trying if the athlete is willing. If you do need to see a doctor, pick one that's interested in sports and one knowledgeable in the problems that occur in your age group, in back injuries that occur in sport, and that are knowledgeable about your sport. Making sure that everyone's on the same page will save a lot of time and add confidence that we all have the same goals in mind. If the pain isn't at least improving in the first week, it's time to consider a diagnosis other than muscular. Trying different treatments for weeks or even months without a clear diagnosis is keeping the athlete in pain and keeping them from full practice. The list is long, and the one that I want to really focus on today is when there's pain in extension in the adolescent athlete. It could be a spondylolysis. A spondylolysis is a stress injury of the low back. Now, in adults, we don't always find the cause for their low back pain, but in adolescents, we are more likely to find the cause of their low back pain. And it's often an isthmic spondy, or a stress injury from overuse or repetitive extension. Now, there's other causes of spondies, but today we're really going to focus on the isthmic spondy because it's the one that most often occurs in sport. So who gets it? Well, research has been done on this, but to keep it simple, if you're an athlete, you've had more than 2 weeks of back pain, you're a teenager, and it wasn't from a crash, there's a 50% chance that you could have this diagnosis. Well, here's where it occurs in your back. Looking from the top, this is the body of your vertebra, and the weak area in your back in a growing athlete is the pars and the pedicle. From the side, here's the body of the vertebra, and once again, the pars and the pedicle. With repeated extensions in sport, this area can get stressed out and even fractured. We call this a spondy. If both pars fractures, the body can slip forward, and this is called a spondylolisthesis. There are several grades. The higher grades may require surgery. Spondy-type injuries can occur in any sport, but they're more likely to occur in sports that have extension, gymnastics being the classic example. But you can see the volleyball and tennis players serving, and while they're in their air, it's okay for them to be an extension. But if they land an extension, then this is what puts them at risk for a spondy-type injury. Typically, the athlete will report no fall or recall of why their pain started. They've had months of pain because things haven't gotten better with the typical treatments. The pain is at the midline and at the level of the belt or even lower, sometimes going into the hip. Sometimes the pain even goes into the leg. We call this radicular. It hurts worse with activity, but eventually it starts even hurting at school with prolonged sitting. And it almost always hurts worse when they bend backwards. First, there needs to be a good exam. And while the exam is important, often imaging studies are also needed for an accurate diagnosis. X-ray is typically the first place to start, and sometimes it shows the injury. There's lots of other possible studies to do, but because of the expense, and some of them have radiation, it's best to have a healthcare provider that is knowledgeable in back injuries in the adolescent to make sure that we're doing the most efficient, cost-effective, and safe approach to getting the right diagnosis. An X-ray is the right place to start. It's relatively inexpensive and relatively safe, and if you see the injury, you can stop there. See the fracture? And it slipped forward as well. A CT is very effective in diagnosing a spondy, but it's more expensive and it has radiation. So I reserve it till the end if I can't find it with another imaging study. Here's a spondy on the left in an X-ray. It's pretty subtle, but on the right with the CT, the fractures are pretty obvious. An MRI is usually where I go if the X-ray doesn't show it. Now, it's not cheap, but it's very safe. There's no radiation. And if you know what you're looking for, spondies can show up like a bright light. And that's enough for us to make the diagnosis and start the treatment. When I started diagnosing spondies, the SPECT, or the bone scan, was the gold standard. We've gotten away from this because of the expense and the radiation. But I wanted to show it to you because I use it every once in a while, and some people still use it as a diagnostic tool. See the flare of light? That's a spondy. If you've been diagnosed with a spondylolysis, spondylolisthesis, bone bruise, or a stress injury of the lumbar spine, you need to get treated. It's unlikely to go away on its own. The treatments all start the same. It's rest. And during that time, I recommend a back brace. While research doesn't say you have to use a brace, it's the best way to prevent you going into extension, the cause of the injury in the first place. It's also a good reminder to the athlete, parents, and coaches that there's a real injury and there needs to be rest during this time. If there's pain into the leg or the butt, that's called radicular pain, and injections are often used. After about 6 weeks of rest, there's a slow return to sport with a physical therapist, knowledgeable in spondies and in your sport. And in my experience, about 90% of athletes return to full sport. Those that have spondylolisthesis of a grade 3 or more Or if this treatment approach doesn't work, surgery is considered, but it's not commonly needed. So brace or surgery. The non-surgical approach is always tried first. And if that doesn't work, there are surgeries that can resolve the problem. Thankfully, surgeries aren't usually needed. But if it is, it's typically a long time out of sport. And so trying the rest and brace approach first makes sense. Injections are considered if you have radicular pain or pain into your legs or buttock. So usually people don't need an injection. But if you are having that pain, there's a 92% chance it'll work, so it should be considered. PT is essential, but the order is important. It's rest to get out of pain first, and then seeing a physical therapist that's knowledgeable in back pain and your sport. The timing is important too. Usually it's started within 10 weeks of your diagnosis. I try to start it within 6 to 10 weeks. And doing PT before going back to sport hopefully delays or completely prevents spondy pain from returning. Now, if you only rest and then go right back to sport, it's likely to be exacerbated again when you start extending again. And if you only do PT and you don't do the rest phase first, the PT is likely to continue to exacerbate the pain that you already have. So it's rest, PT, progress back to sport. Here's some prevention exercises that can be tried before you have a spondy. There's some evidence to suggest that people that are more likely to get a spondy may delay getting a spondy or prevent it completely with these exercises. These are called windshield wipers. Putting your foot up on a mat and swinging your leg to the right and to the left for hamstring stretching. And other hamstring stretching exercises are important too. We think that tight hamstrings contribute to spondy pain in athletes that extend. The next exercise is with the athlete on an exercise ball, core tight, moving forward and backward on the ball in sets of 10 and perhaps doing 2 sets 2 to 3 times a week. Here's the athlete on the exercise ball rotating their legs back and forth, right to left. This is a harder skill. The ball wants to slip out from under you. Keeping core tight is important and not extending your back. The whole purpose for this is to muscle memory train your body to stay core tight. The less extension your low back has, the less likely you'll get into spondy trouble. Here's some more muscle memory work. Extending against the wall with the green arrow of concentrating on your extension being at your shoulders rather than the red arrow, which is at your lumbar spine. Here's another example of the athlete rotating while they're extending. Once again, the green arrow showing the extension concentrating at extending at the shoulders rather than the red arrow showing extension at the lumbar spine. Here's some more core work. Alternating hands and legs while core neutral, not an extension. And on the lower pictures, having your arm pass underneath a core neutral position. Doing it about 10 times a set, perhaps 2 sets, and doing it 2 to 3 times a week. It's all about muscle memory and keeping the athlete in core neutral as much as possible. The long-term research suggests that about 2/3 of people return to full sport. In my experience, it's about 90%. The research suggests about half the people had recurrent back pain within 3 years. And my experience, it's about 1/3. And about 1/3 of people in the research required further treatment. And that's my experience too. And that's frustrating because those people that required more than one treatment often require several treatments. And some of them even have to consider changing sport. The risks were being female, more than one level of injury, or they didn't get better after their first treatment. Muscular causes of back pain in sport are common. But the purpose of today's presentation was to show you that so are spondy-like injuries. If you're an adolescent athlete that didn't crash and has more than 2 weeks of back pain, especially if it's in extension, there's an almost 50% chance this could be spondy-like pain. Spondy injuries include spondylolysis, spondylolisthesis, bone bruises, and stress fractures of the lumbar spine. They're often treated the same at first, with rest, often a back brace, physical therapy, and a slow progression back to sport. Rarely are injections or surgery necessary, and the treatments are usually effective. So, get the diagnosis and treatment started so you can get out of pain and back to full practice. Don't delay with weeks or months of ineffective practices, being in pain, and not having the right diagnosis. I'm Dr. Randy Goldstein, and I hope you found this helpful. Be well.